Welcome back. This is Dr. Jin Sung, where clinical excellence meets excellent results. Today we're going to talk about anxiety. Anxiety is running rampant here in the United States, right? Especially with COVID and being isolated, and children are being affected and so forth. So anxiety is a big player in mental health disorders. Actually, it's the number one mental health disorder in the United States. So let's take a look. So anxiety symptom relief. So anxiety is the most common mental health disorder in the United States. 40 million Americans over the age of 18, which comprises about 18% of the population over 18, right, has anxiety. In children 13 to 18 years old, the number is even greater, 25.1%. So if you look at this number, it's astonishing. It's almost, 1/5 of the population who has anxiety disorders, right? Or some level of anxiety. So what is anxiety, right? It's basically a sympathetic overdrive. If you have a fight or flight system, things need to be balanced, right? You can't always be scared, right? You can't always be on a heightened alert state. You need to be able to relax. So with sympathetic overdrive, the part that drives that fear, anxiety is heightened, or the parasympathetic portion is underactive. So essentially, it's an imbalance of your sympathetic or autonomic systems. So what are some of the things that can drive the sympathetic system, right? One is caffeine, right, or excessive caffeine. Coffee could be good or bad. It really depends on the individual. But if you drink coffee and you have negative impact because of caffeine, you might want to consider stopping caffeine intake. Hypoglycemia. And the reason hypoglycemia can affect anxiety is because you have drops in blood sugar. So hypoglycemia is where you eat something, you feel better, you miss a meal, you feel terrible, right? It's the classic symptom or commercial where you have that Snickers bar and you eat the Snickers bar, but before you actually eat it, you get angry or nervous or just, irritable. And then you eat and you feel better. Those are classic symptoms of hypoglycemia. The other one is insulin dysregulation. So not just the hypo or low blood sugar issues, but down and up or spikes of insulin. So those come with people who have diabetes, right? Or insulin resistance. So insulin resistance becomes a major problem, a driver of the sympathetic nervous system, because with blood sugar, with insulin, drives cortisol. And cortisol is your stress hormone. Food sensitivities. So a lot of people don't realize they have food sensitivities, but food sensitivities can also create low-grade inflammation. And inflammation is a driver that affects the autonomic system and the brain itself, right? So food sensitivities become a problem. Another one is glutamate, right? Or monosodium glutamate, or MSG. There's MSG in a lot of prepackaged foods, right? And they use it a lot in flavoring in certain restaurants. So when you have excessive glutamate in your diet, right, it can drive your excitatory neurotransmitters and create anxiety. So it's very important to eliminate glutamate or monosodium glutamate out of your diet. And diet itself, right, inflammatory diets, diets that are full of processed foods, dairy, gluten, sometimes it can be lectins and nightshades. But inflammatory foods can also drive the inflammatory process, which in turn affects brain function, increasing sympathetic tone. So when we look at some of these things, how do we address it, right? Obviously, if you're drinking coffee, you need to stop, and you have to eliminate the glutamate or monosodium glutamate out of your diet. We need to figure out what your food sensitivities are. And we surely have to make sure that we have proper levels of insulin and blood sugar regulation, right? So it's very important to do those types of things. So if we look at anxiety, what can we do, right? So obvious things is changing your dietary regimen and intake and so forth. So getting rid of MSG and inflammatory foods. So reducing inflammation. What does that mean? You have to change your diet. You have to take some supplements to reduce inflammatory load. Some of the things that help are turmeric and fish oil, right? So there's a lot of commercially available extracts of these types of things. Just make sure you're using a high quality supplement company in order to buy these. I do have an online store, so you can see the link below, and you can go ahead and sign up. And the company carries only high quality physician brands, right? So turmeric and fish oil. B vitamins. So it's not just a matter of taking B vitamins, but the proper forms of B vitamins, right? What we call methylated forms. So B vitamins are very important, B6, B9, B12, etc. Probiotics. Why probiotics? Probiotics affects the gut. And the gut is responsible for a lot of different things, including neurotransmitter production. So probiotic is very important because gut function also eventually affects brain function. So it's called the gut-brain axis or brain-gut axis because the enteric nervous system impacts the brain. So probiotics can be helpful for some people who have anxiety. Magnesium coenzyme Q10 is also very effective. L-theanine can be also very effective. So, but before taking all these supplements, you have to make these lifestyle changes, right? Because supplements can only impact it so much if you're eating a very poor diet. So dietary intake needs to be first, followed by supplementation. And supplementation should be done strategically with your provider, right? You shouldn't just be taken randomly. That's why when we have patients or we take on patients, we look at what they're taking and probably eliminate a lot of them because it's not effective. You have to be more specific with your nutrient content. So other things you could do lifestyle-wise, you have to improve sleep, right? You have to sleep at a regular time, get up at a regular time. You can't go and get up 5 times a night. You have to make sure you don't have sleep apnea, right? Or sleeping disorder, right? You have to fix those things. Avoiding electronics and EMFs. Electronic fields become problematic. A lot of EMFs, electromagnetic frequencies, Wi-Fi, cell phones, cell phone towers. There's so many magnetic fields around us, and that can affect your brain. And then exercise. Exercise is very important because it improves your good neurotransmitters and good hormones and helps you to relax afterwards. So exercise is imperative. So do lifestyle changes first before doing supplementation, but the foundational pieces need to be in place for you to start to feel better. So with anxiety, now anxiety is driven differently for every individual. So these are general recommendations, but when patients come in, you do have to analyze what's going on with them and do a deep dive into what is causing the anxiety. Sometimes people come in, they had head trauma years ago, and they have no idea that concussion that they had in high school or in cheerleading or whatever it is, right? Those multiple concussions can drive the sympathetic system and create anxiety. And also balance disorders, right? Dizziness. When you have vertigo and dizziness, that also affects anxiety. So you really can't supplement your way out of every type of anxiety. You have to be able to target your therapies and target your nutrients in order for someone to get better from the anxiety disorder, okay? My name is Dr. Jin Sung, where clinical excellence meets excellent results, and we'll see you guys next week on the healthy side. Have an awesome day.